Here's the latest on the health care debate going on in Washington. President Obama is making the phone calls, and he's having private chats with House Democrats who voted no last time on the health care reform bill. He's also touching base with those who voted yes, but are now a little more hesitant because of all the shenanigans going on. White House aides say they have a war room to track committed and wavering congressmen.
And joining us on the telephone right now is Representative Brian Bilbray with more. Yesterday, we talked to our local Democrats, and today we're talking to our local Republican representatives. Good morning, Congressman.
Good morning, Sandra.
Boy, the heat is really ratcheting up. A new Wall Street Journal poll out shows that even though almost half of Americans vehemently are against this bill, core Democrats are still pushing it.
I tell you, it's extraordinary. It really is going to be a civic lesson for all of us. I just feel sorry for those guys, the moderate Democrats, who are literally having their arms twisted. And then you even get the extreme from the left, like Dennis Kucinich, a buddy of mine, who obviously got it going over with that on Air Force One for an hour. I can imagine how he's going to explain the switch in his vote after flying with the president, but I'm sure he'll be creative.
Congressman, they're talking now about doing what I use the word shenanigans. Other people have used it too, using this deeming procedural vote issue in order to get this through. Didn't the president say that it's time for an up or down, yes or no vote on health care? That's not what that would be, right?
Yeah, no, and the president also, you're absolutely right. And the president also said, look, people are more outraged at the tactics than the substance. Well, then why go to these extraordinary levels of? Do you really think that the American people don't know what's going on? You know, Washington right now is acting like they're too smart by a half, and they really think they're so much smarter than the average citizen to say we're going to have a bill that doesn't allow Congress to vote on the bill. We're just going to have them vote on a procedural rule that automatically passes it, and as if somehow this is so smart that the American people won't understand what's going on. And, you know, let me just say this, Sandra and Russ, I've seen a real transition in this town when I came back to Congress in 2006. And there really is a real problem with people thinking that these procedural maneuvers somehow are not going to be judged in themselves. I mean, how you do something is important.
Right. Now, I heard that there's a possibility that this vote might not happen until Easter. It might be pushed back again. What are you hearing this morning in Washington?
If there's not the votes, it won't be. But right now, we're told we're going to be here over the weekend. The president has demanded a vote until before Sunday when he plans on leaving. But that's no way to govern a nation, the size of the greatest country in the world. I mean, this really is procedural, push. Everything's more important than doing the right thing. And I just really think it's time to say, let's count to 10. Let's talk about the things we can agree on and move forward there.
Well, I was going to bring that up because, Congressman, we still, we can talk about all these procedural things all we want, but bottom line is that we still need some kind of health care reform. I think everybody that's polled agrees on that. So if we're going to keep fighting over the weekend, where do we go after that if this doesn't pass?
Well, Ross, you saw us actually work together last week. There was a vote to eliminate the protection for the insurance companies from antitrust laws. Republicans and Democrats went ahead and voted for that overwhelmingly. And it's because we ought to break up these monopolies in the state, where the state of California says that you and I can't buy an insurance policy from Nevada, and we're going to break that up. We should be able to agree to do that. We should be able to look at expanding the competition. Look at things like tort reform, which really has been a breakthrough we did in California, and everybody knows that is a $53 billion savings. We don't know things we can do.
Isn't that all a moot point? Is this going to pass this way? What do you think?
I think their attitude is it's going to be this way or the highway. The president really realized he's burned up a lot of political capital in a whole year during a major recession talking about the health care, and people are saying, well, what about jobs? If I have a job, at least I have a chance to get my health care through a job if I'm employed, and let's go back to jobs. I think that he's basically said, I don't have time for another meeting, bipartisan meeting, 6 or 7 hours talking about this. I want to either vote on it and move on or forget the whole thing.
Well, I know that the White House phone system is being flooded from calls from Americans. We're going to be talking to our correspondent Samantha Hayes in Washington in just a little bit. Congressman, thanks for your time this morning. Appreciate it, and I'm sure we'll talk to you again soon.
Sandra, pleasure as always, and nice to talk to you, Ross.
All right, thank you.
All right, Congressman Brian Bilbray, and we will be talking to Samantha Hayes. I can only imagine what those White House operators